Hello everyone, I am Dr. Molina Patel from Akanksha Hospital and Research Institute, Anand, Gujarat, and today I will be discussing about the importance of holistic approach to health in women. So let me ask you all, what is the importance of health? What is health and what is wellness? Is it merely just the absence of a disease? Different people may have different perceptions regarding health. For some, it is having a healthy lifestyle. For some, it is all about detoxification, consuming superfoods. A lot of people nowadays are also emphasizing on mental health and mental happiness. Spiritual health is another aspect. In these COVID times, a lot of emphasis is also given on building your body's innate immunity, and that is also a part of staying healthy. Overall, I would say that a healthy mind always stays in a healthy body, and so taking care of your bodies is of utmost importance for us women. And why is women's health so important? Because a lot of your family members' health is dependent on the woman's health. The health of your children, your spouses, and per se, women always uplift each other. So interplay of health between women in a society is also very important. So today we will be discussing just a few picked conditions which are very rampant and which need to be addressed, and they must know some details about it. First and foremost, I would like to discuss about the lifestyle changes and lifestyle disorders in women. Studies say that 68% women are suffering from lifestyle conditions simply due to meeting pressures, deadlines, long working hours, and neglect of the body. The next thing is the high risk pregnancy. Older the egg, older the woman, we know it all that it gives rise to a high risk pregnancy, and it may predispose the woman as well as the developing child to a number of conditions. Maybe there can be bleeding, development of hypertension in pregnancy, diabetes, recurrent miscarriages, failures, etc. The other set of conditions are the hormonal imbalances. As women, we always blame it on the hormones, and these can lead to several mood swings, anxiety disorders, restrained issues with the family, and ultimately towards the end of the biological clock, these hormones deplete and you will get menopause. A very important and a commonly encountered problem amongst working women is also vaginal discharge and urinary problems. Women present with itching, pricking sensation down there, constant discomfort, they are not able to concentrate on their work, urinary leaks and urinary burning. So all these need to be addressed. I would like to tell you there is a cure for all these conditions. Another important thing that we need to tell you all is about breast cancer and cervical cancer awareness. Breast cancer is a very common problem. It is the second most common cancer encountered in women, and one woman every minute and one woman every 13 minutes is dying of cancer, and one woman in every 1 minute is diagnosed with breast cancer. The best thing that you can do is early detection, and that itself will improve your prognostic factors. Breast self-examination must be discussed with your gynecologist, and you must practice it in front of the mirror, in the shower, in the lying down position to detect any early abnormalities in the breast. Cervical cancer is another important factor. It can be easily detected using simple tests and blood tests. A very important examination is the Pap test, which is a Papa-Nicolau test. One thing that I forgot to mention is that after the age of 20, regarding breast cancer, self-breast awareness and self-breast examination must be done after the age of 20 years. Coming back to cervical cancer, Pap smear needs to be taken after the woman is sexually active every 3 years after the age of 21. And once the woman turns 30 years until the age of 65, you can even back it up with a blood test to detect HPV, which is the most common organism. A very important group of disorders are also the urinary leaks. Actually, a lot of women who have had difficult deliveries, had long labor pains, there was a use of forceps or vacuum in the delivery. Later on in menopause, because of the insult caused at the urethra, some hypoxic damage back then, it will cause urinary leaks, and there are various other etiologies that also justify this. By the time the woman has already started leaking while she coughs or squats or talks loudly, she has neglected herself for so many years. And once you go to the gynecologist, you will be asked a detailed history regarding this, infections will be ruled out, and now a lot of energy based devices are also available which can treat these urinary leaks without the need of a surgery. Menopause. Menopause is another part of a woman's life. It's actually called puberty part 2. So menopause means the complete cessation of menstruation for a period of at least 1 year. And perimenopause means the transition, a smooth transition which may last up to as much as 10 years between your reproductive life as well as approaching menopause. When a woman approaches menopause, she has to be dealt with a lot of care and in a multi-dimensional approach. There are certain hormonal treatments as well as behavioral therapies and non-hormonal therapies which are available, and these may include even acupuncture, recommendations regarding exercise, healthy lifestyle, isoflavones, physiotherapy. The next I would like to talk about is the diet. So 3 key concepts about diet. Actually a lot is being said and we are full up to here with information regarding different diets. But all I would like to say is 3 important things. The most important is what to eat. So foods that are visually appealing, have lots of colors, are actually very rich in micronutrients and minerals. So you must include a lot of fresh fruits and vegetables. Avoid anything that is processed, nothing that comes from a packet, no colas, no candies and no burgers and junk food. The next is you must always eat local and eat fresh. Fresh local produce, your wholesome grains, dairy products, fruits, vegetables, homegrown is nothing like it. So this is the best way to go about. The next is how much to eat. I always tell my patients that you must eat just before you are totally full. Mindful eating must be practiced. And you must eat with the 3 S's. That is, I came to know this from a very well-known dietitian called Rujuta Divekar. So you must eat with all your senses, you must savor all the flavors, you must sit down and eat, and you must eat extremely slowly. When should you eat? So a lot of concepts are now being said about circadian rhythm fasting and that you should just eat few hours in the day. And these actually work wonders and have a lot of other benefits, and I have personal experience regarding that. But overall, you must eat frequently, small meals and way before bedtime. Immunization in women is also very important. It is commonly asked question by our patients. How often should you get your blood pressure checked? So BP checkups recommendations say for Indian women are a must every year after the age of 40. Height and weight checkup is must during every annual visit to the doctor so that your weight is in accordance with your height and by and large you are maintaining your BMI. Cholesterol and sugar check must be done every 2 years religiously after the age of 40, and all these parameters can be assessed more frequently depending on your clinical profile and family history. An important part about health is also to deal with stress. This lockdown has taught us a lot about self-care and how to de-stress in its own way. De-stressing can include either meditation, spending quality time with your children, reading a good book, or simply picking up the phone and catching up with your friends. But self-care and de-stressing goes a long way when it comes to holistic approach to health. A little bit of information regarding infertility. It is a taboo in the society that it is by and large a woman's problem, but nowadays we are also seeing that male infertility is on the rise with increase in the drug abuse, wearing tight clothing, stressful lifestyle. Males also have some compromised aspects regarding the semen parameters, and this also needs to be addressed. So even your husbands and all those women planning pregnancy, you need to be mindful about this as well. For all those women who have or who are thinking about getting IVF treatments done, it is a great indication for a lot of women who have failed to conceive naturally and are trying since a lot of years, and you may discuss IVF treatment at length with your infertility specialist. For those women who are very stressed about their firstborns being born with some or the other abnormality, it is now possible to actually eliminate the genetic disease right from the embryo stage using pre-implantation genetic screening and diagnostic testing. So finally, to conclude that, as Michelle Obama has rightly put it, that health is not about measuring your waistline or measuring your weight. It is all about how a woman feels on the inside as well as on the outside. So it's little steps and modifications that a woman makes for herself and her family on a day-to-day basis. So ultimately, this goal of achieving a healthy lifestyle can be achieved. Thank you.